Hello, my name is Cynthia Mathieu. I'm a professor and psychologist, and in today's video, I'd like to talk to you about burnout. Now, I know that it's a term that you've heard a lot, but what is it really? What are the symptoms? And clinically, can we say burnout? The answer to the last question is no. When you go to the doctor's office with burnout symptoms, you will probably get a diagnosis for adjustment disorder. Adjustment disorder is classified in the psychological or psychiatric disorders that are associated with stress, just like post-traumatic stress disorder. That is triggered by a very intense stress or trauma. Burnout or adjustment disorder is created, or one of the factors explaining adjustment disorder is stress, but the stressors can be in the workplace, they can be in schools, they can be in our personal lives. So it is a difficulty adjusting to those stressors. So what are the some of the symptoms? You can, with adjustment disorder, you can have either depressive symptoms or anxiety symptoms, and oftentimes you actually have a mix of both. So general sense of discouragement, general fatigue, not having your usual amount of energy, difficulties concentrating, also changes in your sleeping habits. So either you are having a hard time falling asleep at night, you're waking up often during the night, or you could also be waking up very early in the morning and having a hard time falling back asleep. Another change in behavior could be in your eating habits. Now, some people, when they're not feeling well, are stop eating, and not necessarily stop eating, but decrease the amount of food that they eat. Others actually increase the amount of food that they eat. So that actually is a symptom that you can see in others. So the weight change can be just a sign that someone's not is not doing well, and an overall feeling of being overwhelmed and not being able to kind of manage life in general. So those are the symptoms. When should you be worried about those symptoms? Having those symptoms in our lives at certain points during the year even is normal. But when you are having those symptoms and they are present for a certain amount of time, that you've tried to manage them, but they are still there, and you see that the situation is not getting better, and it is affecting the way that you function in your personal life or in your work life or school life, then it is probably a good time to seek professional help. And it can take different forms. But one of the things that I want to tell you is a lot of people are afraid to go and call or see a psychologist, thinking, oh, this is going to take years. But oftentimes when people go at the beginning of the symptoms, when the symptoms are just appearing, it takes a lot less time in therapy to be able to get better. So the thing to remember is the sooner you get help, the better you'll feel. And it won't take as much time to work on eliminating or managing those symptoms. So because burnout is created or triggered by stress, one of the things that I would tell you to do is start writing down the stressors in your lives. What are the situations? What are the maybe the people that are putting a lot of pressure on you? And therapy is not a magic pill. You will have to work on what causes your symptoms. and you will have to make some changes in your life. And it's one of the important things in therapy is being ready to make some changes. And so you don't need to go to therapy to make those changes. You can act as, as you see some symptoms appearing. It is very important to get to know yourself. What are the first symptoms that appear when you're under stress? When you're in a situation where you're highly uncomfortable or feeling a lot of pressure. Once you've identified those symptoms, then when you see them appear, take notes. What's going on in my life? What can I change? And if you see that they you're not getting better, then quickly either call your employees assistance program. If you're in school, you have counselors. Same thing for college and university. You have psychological services for the general population. It could be the hospital, other public help, or even on the phone. You can sometimes call and get help. Now there are Zoom or Teams therapy, so that can be done. So there are a lot of services out there, either the private sector or public sector, and I'll leave a list in the comments section. But please don't wait too long and go get help if you find that the symptoms are overwhelming, and start looking at what you can change in your life. And also make sure that you are doing things to that help your mental health. So going outdoors, spending some time with the people that you love, be kind or kinder to yourself. It can be watching a good movie on a weeknight, doing things that really help relieve the stress that you have or that you might have during the day or in different situations that in your life. So I hope that you have enjoyed this video. I will see you next week. Until then, take care of yourself. Bye-bye.